Everyone knows about drug abuse and how integrated it is into our culture today, but do you know the extent of how much it has affected the youth and adolescents in today's society? My goal in this speech is to inform you all on how integrated drug abuse is in the youth of today and society in general, the effects of drug abuse on the body, and how difficult it can be to work with in hospitals. To some, family members or friends may be addicted to various drugs and how dangerous they can be to not only the user, but the people around them also. It's a sad reality we all deal with on a daily basis. I will be citing many sources throughout this speech, all medical professionals from prestigious colleges reporting peer-reviewed information and research that will be used to inform all of you. Some examples of the people contributing to this scientific information in this speech are Leo Beletsky, Linda Trudeau, and Andrew Geller. My main points will be showing you how drugs affect our economy, youth, and availability of healthcare for all people today. I will first explain how drugs have affected the economy and their accessibility to people who actually need them. In an attempt to control the opioid crisis in America, policies were put in place to restrict the access to prescription drugs. This, while intending to help stop the crisis, only put it in a worse position due to misusers turning to other places to get them, like the black market. Beletsky says that, on one hand, policy and programmatic responses to what was then called the prescription drug crisis were focused on restricting the prescription opioid supply. This included the advent of soft and hard regulatory instruments to reduce opioid overprescribing, diversion, and misuse, resulting at the extreme in involuntary tapering or patient abandonment. In response, PDMPs, or prescription drug monitoring programs, also became a core component of the response to drug abuse, as did the reformulation of drugs to make them harder to crush and inject, and the threat and actualization of prosecution of unscrupulous prescribers or pill mills. This hike in price due to supply and demand imbalances in prescribed and non-prescribed drugs not only caused more death due to cutting costs and pills with fentanyl, but also an increase in price for prescription drugs due to availability and more restrictions to actual customers who need them buying them. Beletsky also says, once exposed to black market products, opioid users' overdose risk is substantially shaped by fluctuations in the clandestine supply chains. Simultaneous increased demand and scale-up in interdiction efforts set the economic conditions for the advent of more potent and cheaper synthetic opioid alternatives. Both of these contribute to the loop that is the opioid problem today. Not only does it affect addicts' lives, but the people and society around them too. If you personally are in need of prescription medicine, it is very difficult to obtain one due to all of these problems still going on today. Not only are they hard to come by, but they are also still very expensive, even with insurance, given you have it in the first place. In an attempt to aid the opioid crisis, a combination of new policies and reactionary changes in price and demand have made the opioid crisis not only expand to the streets of America, but also cause price hikes and low availability of safer and scientifically produced medicines to people who need them most. Along with the plague of drug abuse amongst youth come the consequences of the same group using them. Certain drugs are very bad for developing minds for several reasons, mainly on the developing brain and behavior. Linda Trudeau says that studies have documented the association between depression symptoms and substance misuse, quoted by Muser and colleagues in 2006, articulated 4 explanatory theoretical models that could apply to the relationship between psychological symptoms and substance misuse. 1, a common factor model. 2, a self-medication model. 3, a symptom exacerbation model. And 4, a bidirectional model. Due to the war on drugs fought by America, there's not much studying that has been done on drugs today, but with what little there is, it has been shown that drug abuse and depression link up in several ways and have various consequences. Trudeau says, depression symptoms are associated with impairments in functioning and have substantial health and economic consequences. Universal substance misuse prevention programs have shown effects on non-targeted mental health-related symptoms, but long-term effects are understudied. Although these long-term effects have not been studied yet, I'm sure that they do not turn around to a positive path. If current abusers have these problems now, who knows what physical and mental problems may be caused in the future. All of this adds into how restricted hospitals are now that they have to deal with a multitude of patients using non-prescription drugs. Many patients that are hospitalized are due to prescribed and non-prescribed drugs. And Geller says, based on 5,130 surveillance cases from 56 EDs, there were an estimated 358,247 ED visits for harms from non-medical use of pharmaceuticals in 2016, compared with 1,474 ED visits for harms from therapeutic use of pharmaceuticals. That is a massive amount of hospitalizations, and that is just from 2016 and the ED department. These cases, although there are multiple substances that can be contributed to this statistic, are mostly benzodiazepines and prescription opioids. Geller also states, overall, benzodiazepines and opioids were the most common pharmaceutical classes involved in ED visits for non-medical use. Benzodiazepines were involved in 167,845 of estimated non-medical use visits, and prescription opioids were involved in 129,863, or 36.2%, of non-medical use visits. Benzodiazepines, or prescription opioids, were involved in 71% of non-medical use ED visits. Benzodiazepines and prescription opioids were co-implicated in 12.1% of non-medical use visits. No other pharmaceutical category was involved in greater than 10%. I'm sure everyone has been to the hospital, but imagine if you or a family member is unable to be treated due to the overwhelming amount of cases of the opioid epidemic. There's an appalling rate of hospitalizations due to the non-medical use of pharmaceuticals, when those beds could be used for many patients in danger due to natural or even widespread diseases like COVID-19 this year, for example. In conclusion, there are many factors that go into the cost of pharmaceutical drugs themselves, who it affects, and how many people are hospitalized due to non-medical pharmaceutical drug use. This speech is supposed to teach you about how all those factors affect you and all of our society today. I feel as though more people understand and acknowledge how much of a problem that this is, the more there will be done about the hard-hitting reality of drug addiction and abuse and its effect on our society and economy. Thank you for listening, and I hope you all learned a lot about the intricacies of the problems with drug abuse.